The second guest today is Dr. Helen Cross, the Secretary General of ILAE, child neurologist in UK. Hello and welcome in Romania.
Hi.
Why it is important to have an international league against epilepsy?
The International League Against Epilepsy is the international organisation for professionals involved with the management and treatment of individuals with epilepsy. It is important to have an international organisation as it brings individuals together. Our main mission is to enhance the lives of those individuals with epilepsy. We do this through looking at diagnosis, looking at treatment, reaching consensus views, but also directing and enhancing education and training for those involved with individuals of epilepsy to improve their management and services globally.
It is not your first visit in Romania. Have you noticed any difference between strategy in treatment in Romania and in the rest of the Europe?
I have been coming to Romania for several years. This is my third time in Romania. And I have had ongoing contact with child neurologists from Romania. And what I have noticed over time is an increasing desire to bring the level of knowledge and services up to that of others elsewhere with increased resources. Certainly I have noticed that with time, and the desire to treat individuals, particularly children with epilepsy, as others would elsewhere with optimal resources is certainly there, and the knowledge base is there. I have noticed that over time.
What do you think services can improve for a greater benefit of the patients with epilepsy?
As I have pointed out, I think the knowledge base is certainly there amongst those individuals that I have contact with, professionals I have contact with regard to diagnosing and managing children with epilepsy. There are some resources as well, magnetic resonance imaging, brain scanning, that is there, diagnosing the underlying cause. There is also a desire on the part of individuals to look at genetic collaborations. However, there are some treatments that could benefit those children who have more complex epilepsies, perhaps drug-resistant epilepsies, such as utilisation of ketogenic diet and epilepsy surgery, that are not yet available for children. And I think these are areas where there is a desire, but the resource is not yet available to provide those services, and certainly should be looked into. There are certainly enough children who could benefit from surgery in Romania to justify at least one specialised centre in the country. Another area that I think is different to the other parts of Western Europe is that not all medications are available, either for emergency use, for treatment of convulsive seizures, or indeed for ongoing use. This leads to a treatment gap for those individuals with epilepsy, and where children and adults may respond to certain medications. If they're not available, then that restricts their management.
Yes, indeed. Thank you for the interview.
It's okay.
Aici se încheie ediția de astăzi. Sunt Laura Popescu și vă mulțumesc pentru atenție. Sănătatea în realitate vă privește. Rămâneți sănătoși!